Dr. Robert Hardesty, a board-certified plastic surgeon working here in Riverside, California. Today's topic is implant placement. As we decide what type of augmentation to perform, silicone versus saline, shape, size, dimensions, content, fillers, we have another decision to make, and that is the placement of the implant on top of the muscle, which is called suprapectoral or subglandular, or under the muscle, which is called subpectoral or under the muscle. But let's first talk about the anatomy. The pectoralis major muscle is a flat muscle that is fan-shaped. It inserts in the sternum and the clavicle and into the humerus. With this, its function is to aid in throwing a ball sideways, picking up a child, etc. Okay, the functionality of the muscle is not disturbed when we place the implant on top of the muscle, nor is it disturbed when we place it under the muscle, because we use 3 access incision sites. One is the armpit, axillary, 2 periareolar, 3 inframammary. And in each of these incisions, we slide on the border of the muscle and then slip the implant in. So, as numerous studies have shown, there is no loss of strength or function by placing the implant under the muscle. Okay, when it's under the muscle, it's called subpectoral. If it's completely under a muscular blanket, that is complete coverage. When it's placed where the bottom of the muscle is, there may be some of the implant outside. That is called the dual plane. One plane under the muscle, one plane under the breast tissue. Okay, so why do we place implants in one place or the other? Let's talk about that. Subpectoral, it covers the implant with padding. Just like if you had a nice carpet, your breast, but there was not much padding under it, you would get a nice pad that would make the breast feel better or the carpet feel better. So it prevents palpability of the implant. On top of the implant, you may feel the implant all around the breast. In the subpectoral or dual plane, the only place you may feel it is out here in the lower outer quadrant where your bra and bathing suit cover. Capsular contracture. That's a process where the implant becomes or feels hard because of scar tissue. It has been proven that placing it under the muscle has a lesser degree of capsular contracture. Visibility. Just as we said before, sometimes the implants can become visible where they're not covered by the implant. Usually more with saline implants than silicone, but in the lower outer quadrants. But on suprapectoral or on top of the muscle, subglandular, you may palpate the implant all over. Initial pain. It is more painful initially to perform the operation under the muscle because we detach it, we slide it under, and we expand it. That does not feel good. But within 1 or 2 days, that remits. On top of the muscle, you can have almost no pain initially because there is no disruption of the muscle. Movement. Now, every time you're moving your arms and things, you're massaging your implants. And some of us feel strongly that displacement exercise and movement decrease the chance of capsular contracture. Now, the only negative about this is in muscle builders professionally. If you curl your arms like this, the implants will go up and out. And that will happen to anybody, even in the gym. So how do we get around that? For the young ladies in the gym, I have them just put on a sweatshirt top and do the upper body circuit and then take that on afterwards. Okay, in conclusion, you have 2 sites that you can put the implant. On top of the muscle, that's called subglandular or suprapectoral, and under the muscle, which is called subpectoral. Thinking of the anatomy as a chest wall, the muscle, and breast tissue. So we put the muscle in the sandwich between the breast and the muscle, suprapectoral. If we put it behind the muscle, subpectoral. The advantages to me of having it subpectoral more than outweigh the advantages of the suprapectoral or subglandular placement. Thank you very much for your attention, and we hope to see you soon.